All right, Georgia, we are live. And it's, of course, my personal pleasure to have you here as a friend. But not even just that. I really value and respect your thought process, your advice on when it comes to anything that has to do with mental health. And mental health in the workplace, mental health in church. I mean, mental health anywhere, because mental health is just mental health. It
Absolutely.
goes with us wherever we go. So, as a matter of fact, one of my little team members says I'm looking forward to listening to today's talk. When I asked for certain topics for TTalks, this was one of the topics I
Yes,
received. Like, okay, talk about mental health in the workplace. So why don't we kick it off with you just introducing yourself to our audience, and then I'll go into my questions.
absolutely. Thank you so much, Sharon, for having me. It's always a pleasure connecting with you. I know we connect in so many different ways, but within the business setting as it is now. So, my name is Georgia Bryce-Hutchinson. I'm a licensed marriage and family therapist based in the city of Fort Myers, Florida, bright, sunny Florida. And I have been in private practice since 2019. I work with individual clients as well as couples and whole families who may be struggling with interpersonal conflict, issues surrounding communication, conflict management, etc., etc. Over the last 3 years, I started engaging the corporate space because I thought it was prudent.
Mhm.
When by the time I have clients getting to my room and we're working through their issues, which for a lot of them they're professionals and so they're coming in with work related issues such as burnout or interpersonal conflict on the job. By the time they get to me, if they are in crisis mode, chances are I'm going to be issuing a leave of absence for these clients. And I
Mm.
remember it was probably about 2 years ago, Ms. Sharon, that I had two clients who came to see me perhaps in the space of 2 weeks. They both were struggling with suicidal ideation because of anxiety and burnout from the job, of course, coupled with some personal things. And so I had to write leave of absences right away for them, amounting to probably about 2 months. So imagine your boss shows up the next day to work and you're not coming in for the next 2 months. Jobs
Yeah.
are left scrambling. So it kind of preempted me to go into the workspace to talk a little bit more about amplifying mental health awareness and why it is so important that employers pay attention to their employees when it comes on to the issue of workplace wellness and well-being, because you don't want me or someone like myself disrupting your workflow and ultimately productivity. So I also serve now as a mental health consultant and I do training centering mental and amplifying mental health literacy in the workplace and also addressing crisis response and intervention.
You said so much there. I wrote down, burnout. I wrote down suicide ideation because I have a leadership page here on LinkedIn, and I had a question this week, and I said, "Hey, what do you guys want to hear about?" And on the leaders' side, they talked about mental health that they
Yes,
wanted to hear more about from the leaders' perspective, and also for burnout. So lots of materials there. Um, and we'll get a little bit, hopefully, maybe if we have time, into the suicide ideation because we're seeing more and more of that
yes,
nowadays. And
unfortunately.
it is. And something you said, someone like you in your position could be very disruptive to the workplace because you're going to issue a 2 month,
Yes,
like,
leave
hey,
of absence if necessary. Yes,
right. So what you're saying is that if that employer would be proactive, so it doesn't get to the place where now this person is considering suicide and I have to issue 2 months. So that's to unpack there. All right. So first question for you.
yes.
What are some common signs and symptoms of workplace stress, and how can individuals identify them early on to take proactive steps? And Georgia, what I'd like for you to give me is two angles, right? How can the individual who is going through that burnout identify, and how can a manager identify it as well?
Absolutely. So, from the individual standpoint, there's several signs and symptoms you may be experiencing if you are struggling with burnout. Burnout ultimately is associated with immense stress, and
Mhm.
so maybe there may be issues with anxiety or depression that may be of concern to you. When we talk about anxiety and depression, we're thinking about mood disorders, right? So
Yes.
perhaps you might be feeling extremely sad, you may be feeling extremely fearful, worried, you're staying up late at nights, you can't sleep, or if you sleep, you wake up and you can't go back to bed. There may be you not wanting to eat. You might be losing weight. You're not setting out to lose weight, although it's always good to lose weight, but you're not setting out to lose the weight, or you're
Right.
gaining weight. You've lost your appetite. You're probably isolating. You're not associating with friends anymore. You're avoiding friends. You're avoiding going out. You're avoiding activities that you used to engage in freely. And just not be able, you're just not able to function effectively at work, or just carrying out the regular tasks that you would, whether it
Mhm.
is at home or it's at work, or if you're someone who's in school. You're having difficulties concentrating on work, carrying out everyday tasks. And so those are some of the signs or symptoms that you would notice as the individual. From a managerial standpoint, or for those people who are spectators, I've always maintained the first thing is that if your employee comes to you and tells you that I am feeling stressed or burnout, that's your first indication.
Mhm.
High stress levels, and you'll notice changes in their behavior. Perhaps there's increased absenteeism. These are, associated with people who are taking off from the job. They were consistently coming to work, and then all of a sudden you notice that they're either taking unplanned time off, or they're requesting time off, or they're just not showing up to the job as they used to. Decreased performance and productivity. That's usually a very poignant sign, right? And so oftentimes as managers, because we're trained to ensure that our workers are staying on task and doing what needs to be done. If you have a worker, or you have workers who are consistently diligent at doing work, and then all of a sudden you find them falling off, they're not
Mhm.
performing as they used to, they're not, their quality of work is going down, they're not honoring or meeting your time schedules as before, quite possibly there may be something that's going on with the individual. Lack of motivation. These people,
Mhm.
these are workers who would be on the job, they would be doing whatever it is that they need to do, and all of a sudden they become lackluster, or they become indifferent, they're not having that drive or that passion. It's quite possible that there is something that's going on. Social withdrawal. Yes, they show up to work, but they're not necessarily engaging their colleagues as they probably used to, or events that's outside of the workspace. They're not participating in that anymore. Complaining about physical health issues. People are complaining about musculoskeletal issues. They're having neck pains, back pains, or they're complaining about high blood pressure,
Mhm.
heart racing, and they're telling you that these things are happening, and you maybe observe that their affect is it's different from normal. One other thing, maybe interpersonal conflict. Everybody regularly gets along for the most part, but all of a sudden you're starting to notice there's a lot of contention taking place between you and the employee, or between employees. There's this constant arguing that's going on, because when people are stressed out, chances are they're going to become agitated very easily. And so interpersonal issues is one of those things that typically comes up in that instance. People complaining about emotional exhaustion. They're tired all the time. And you
Mhm.
see it again in their affect, in the way they move, in the way they respond, in the way they execute their tasks. There's just this lackluster that's behind it. And then just general changes in behavior and attitude. If you notice somebody coming to work who typically would be well dressed, or they don't
Mhm.
smell, and then all of a sudden they're having an odor, they're having body odor, or they show up in the same clothes, every day, or their clothes is not clean, or they look haggard, and that's not their normal disposition. Yes, chances are there are some things that are going on with this individual.
Georgia, you have, I mean, I couldn't write it all down. You have rattled off at least 15 to 20 signs and symptoms. So to say that we as individuals can't catch that in ourselves, or even observing manager, is silly. And so the to this question is probably going to be would have been my follow up. So we hear a lot about quiet quitting these days. How do you define this, and how does this relate to mental health at the workplace? And from what you're saying, there are these signs and symptoms, right? The lackluster, the lack of motivation, isolation. So people just maybe just check out,
Yes.
and just they're there, but they're not there. So that's probably how they have. So I want you to answer this question. Then I also want you to answer, how can employers, right, before it gets to the quiet quitting, what can managers, leaders do to stem that tide? Because, because of what you've described all of these symptoms and signs, then we have this quiet quitting. what can leaders and managers do? But you can define that, and how does it relate to mental health?
So quiet quitting essentially is some kind of a phenomenon that's happening right now, where it's been happening for a couple of months, where people are just showing up and they're just doing the bare, they're doing the basic, right? They're
Right.
doing what we would classify as the bare minimum. They're not going above and beyond, which is typical of what, we talk about, coming in extra early, leaving extra late, because you want to make it up the ladder. A lot of people are not doing that anymore. If I have a set work schedule from 9 to 5, that's all I'm going to do. And when 5 o'clock comes, I'm leaving. Unless you are compensating me in some other way, I'm not going to be participating beyond the time that I need to participate. I'm
Mhm.
not getting engaged in, maybe this might not be work related stuff, but it probably would look good on your resume or would look good in the eyes of your manager. They're not engaging that stuff anymore. They're literally doing the bare minimum. Um, that's not happening in a vacuum, obviously, Sharon.
Yeah.
And this is why this concept of um, amplifying or ensuring that you have a work environment that addresses well-being is so important.
Hmm.
So when we think of work-life harmony, I hate using the term work-life balance though, because a lot of people say balance is not possible, and I get it. You can't always have equity in every area.
Right.
But when
Yes.
there's a lack of work-life harmony, where people have been persistently finding themselves coming to work, working extended hours, working overtime, the job demand is overwhelming. They're afraid to take vacation, because when they take off, and I've had clients who have worked for a whole year without taking not even one day of vacation, because there's this fear that if I leave the job for a week, when I get back, I'm going to be overwhelmed with a lot of work. So you have those kinds of work environments that exist. And so what people have essentially done is that they've just taken matters into their own hands. And if employers are not aware that maybe the way your work is set up or the way it's designed, that it is impacting the well-being of your workers, they are going to do something to combat that situation, right?
Mhm.
And this is why we have what we call the quiet quitting occurring. It's not happening in a vacuum. Something has precipitated that kind of dynamic. What was the other part of the question that you'd asked?
My other part of the question was, how can employers stem that? In other words, you gave us all the signs, and an observant manager is seeing, gee, Georgia's not as vibrant as she used to be, or Chelsea is not as engaged, and she's making more mistakes. Something is happening. What do you think a leader or manager could do to stem that quiet quitting?
Okay.
What could
So
they what could they implement in the workplace?
Okay, so there, I'm going to speak on two ends. It's perfectly normal for you to pull your worker aside to ask, "Are you okay?"
Hmm.
We don't have too many managers, supervisors taking that extra step just to check in with your workers. That is a normal and welcoming experience. Just find out if this is an individual who is not functioning at the top of his or her game as before, and you're noticing these changes or these signs and symptoms in this individual, or the individual is complaining that I'm feeling burnt out. Pull the employee to the side and just find out what specifically is going on. Because
Yeah.
sometimes, Sharon, it might not necessarily be the work environment or the work environment alone. People are coming into the jobs with their issues. I've
Right.
always maintained the people who come to my therapy room are the workers that show up on the job on a Monday morning. And so we're whole beings. People are
Right.
struggling with their personal lives and they come into the workspace, and you cannot necessarily separate the worker from the person of the worker. So there may be things going on the outside. Coming into the job now, what we're saying to employers, what we're saying to managers and leaders is that you're needing, which is my second response, the second part of my response, is that you need to be able to design work or the work environment in such a way where, again, you're not amplifying or adding to the stress that people are already dealing with. Now, we know people will not be able to escape stress. It is
Hmm.
inherent in life, whether it's in your personal life or on the job. There's a measure of stress that we have to deal with. But when things have gotten as intense as it is now, where you're finding since COVID, I mean, prior to COVID, this was an issue, but because people are more vocal about their mental health needs, you're finding more and more people are complaining or reporting symptoms of burnout increasingly. Like every week, I read articles, every week they're putting out a new article that more and more people are complaining about burnout. I believe I just read some recent survey that was done by Deloitte that not only is it just workers complaining about burnout, C-suite individuals are
Yeah,
also complaining, believe it
yeah,
or not. So I
yeah.
believe there was a survey that was done with about 2,100 individuals across, I think it was the UK, Canada, Australia, and US. And half of them were employees, the other half were C-suite. And 70% of the C-suite was complaining about burnout, about isolation, about loneliness, about stress on the job, and saying they would be willing to forego money and even that position to find a job that caters to their mental health. Now, if C-suite people are complaining about that, what do you think your regular employees are complaining about?
That
Okay,
is so true. That is so true.
so then we have to look at the design of our work. What is
Hmm.
it that's happening in the workplace? Why so many people, including leaders, are complaining about burnout? And so, I'm wearing my five. I don't know if you see my five.
Yes, I was going to
And then,
ask you what that's all about.
okay, so it is symbolic. At first, it was just a simple pendant, but then somebody was like, Georgia, what does that mean? And I'm like, you know what? I know exactly what I want to connect this to. So there is something significant happening in work because there's so many organizations from both the international and national levels that are weighing in on this issue of burnout in the workplace. And one such organization is the US Surgeon General, recently in October of last year put out a framework for addressing mental health and well-being in the workplace. And so the US Surgeon General identified 5 areas where
Mhm.
every work environment leaders needed to start looking at and assessing their work environment to see if their work environment is designed to address these areas for their employees. If these areas have been addressed, then more than likely your workers are going to show up, unless it's their own personal issues that they're dealing with. They're going to show up in an environment that is deemed psychologically healthy and safe. What are those 5? They call it the 5 essentials. So the first one, Sharon, is protection from harm. You want to design a work environment where people are protected from harm, whether it is, related to physical harm or it's related to psychological harm. And so we think about security. You want a work environment where people are being adequately compensated. You want a
Mhm.
work environment, especially those work environments where physical hazard is a real issue, whether it's driving or whether it's working in a manufacturing plant where you have equipment that people they could die on the job. You want to make sure that you have systems and structures and policies and programs in place that's tending to those things so that people could make it to work safe and then make it home to their families at the end of the day. You talk
Mhm.
about from a psychological standpoint, do you have policies in place that addresses bullying and harassment? Because that's also classified as protection from harm,
Mhm.
right? So that's one arm of making sure you're designing a work environment that addresses some of these things. The other thing has to do with community and connection. So I've always maintained, Sharon, nobody really goes to work to make friends, or maybe people do. I don't necessarily go to work to make friends. However, if I'm spending 10 hours of my time, when I worked as an engineer, I wasn't doing 8 hours, I was doing 10 hours. I probably had to do even more, depending on whatever timeline or deadline I needed to meet. So I'm spending the bulk of my waking day with not family members, but fellow colleagues. So you want to be able to have some level of a relationship where there's some sort of community or connection. When you think about your supervisor, is this the individual that you could go in and sit down and talk if there's a concern that you're having? Do you feel, they call it psychologically safe, to address concerns or to dissent from a possible position that a leader takes? Can you dissent from that position that the leader takes and present another angle or another perspective? Do people feel safe enough to open up about a concern? Can somebody come to you and talk to you about, look, I'm having some personal issues in my life and I probably may need a day off or so? Is there that fluidity in the relationship? Do colleagues feel connected? Is there support available? Am I having adequate resources to do the work that I need to do? Do I feel included? We talk about the DEI, is there inclusion in decision making, etc., etc.? Community and connection is one of the things that the US Surgeon General has identified, that if you have a system in place to ensure that that's there, it is going to create a work environment where all those stressors that I talked about, all those signs and symptoms of burnout is going to be mitigated. Work-life balance is a third essential from that framework. And we talk about it, work-life harmony. Do people have flexibility on the job? I know there's a tug and pull taking place since COVID-19 eased. Employers wanting workers to come back to
Right.
work full time, and people are like resisting it. Is there flexibility? Do you have to be dogmatic about, well, you got to come to work every day in the physical office? Can you create some level of flexibility where there's hybrid? They don't have to
Yeah.
come every day, and they're not permitted to work at home every day. But can they come some days to work, and then some days they could whatever? Do people feel like they have the opportunity to give themselves to their personal lives as they do the work, or is work entirely consuming them? Are you sending text messages and emails and phone calls to people 11 o'clock at night, and you're expecting them to respond to these things? The work demand, the workload, what is that looking like? Because those are sources of stress, right? And then he talked about mattering at work. That's essential for. That's a big deal, Sharon, because
Mm.
people want to have meaning. I could tell you right now, I've had my own personal experience working in work environments before I started working for myself, where I really wondered if I was more than just a cog in the system. Were you just bringing me in to leverage my skill set? Did you not care that I was an entire person? Right?
Mm.
What does what I have to contribute to the work make a difference? People want to feel like what they're doing, they're adding value and meaning to the work. And so, do you acknowledge them? Do you recognize them? Do you reward them? Again, do you involve them in decisions and processes that ultimately are affecting their lives, right? So, meaning and mattering at work, that is a big deal. And then, number five, he talked about opportunity for growth. Is
Mm.
there an opportunity to upskill myself? Are trainings available? Not just training me in technical competence, but are trainings available in social skills, like soft skills development? A lot of us won't get that anywhere else except on the job. So is there opportunity for that? Is there opportunity for leadership development? Or am I just existing in a system where it's hierarchy and it's very firm and it's top down approach all the time, and there's no opportunity for me to move up the quote unquote corporate ladder, if you want to put it that way? So is there equity in leadership? So these are some of the areas that organizations are going to have to look at. Yes, you can pull an employee one way and have a conversation because that's the nice thing to do. But when it comes on to your work design, you need to be looking at how work is being conducted. If there's some, we call them psychosocial hazards in the work environment that could ultimately be impacting the mental health and well-being of your workers. Because yeah, how many persons are you going to pull to the side before recognizing that perhaps it's not just that one or two individuals who are struggling? Maybe it's an organizational thing that's taking place here, and we're going to have to look at how we design work to do it differently.
That speaks so much to that culture, that we talk about, that workplace culture. And what you're talking to speaks to that, when leaders are looking at this work design, what is that culture? Because is the culture caring? Does it just, how do people know that they matter? What is that culture, that work life, that connection? Are we fostering opportunities for people to connect beyond the 9 to 5 or beyond the work itself? Very, very interesting. We're going to take a couple of these questions from the feed. Okay, so Sarah said, so glad to hear you. I find you to be a very powerful voice to help
Thank
people
you, Sarah.
root causes to trauma, and I love your compassionate, no nonsense way. She said also, healthcare teams are experiencing record burnout, depression, and suicide.
Yes.
Why do you think we're losing the fight in taking care of our caretakers? I'll let you go with that for
Ooh.
right now. Do you have any
You
thoughts
know,
on that?
again, I think it comes down to we have not, maybe perhaps it's just now we're paying attention to these things.
Mm.
And it is quite possible. It may have always been that way, but we weren't paying that close attention to it. Why are we losing the fight? Because I think fundamentally organizations have not fully caught up with some of these proposals, for example, like what the US Surgeon General is putting out. The World Health Organization also created last year, they established and they created a guideline for workplace mental health. So it's quite possible that we're just conducting business as usual. We are aware that people are burning out, we are aware that there is stress, but maybe leaders are not aware that there are some frameworks available to change the
Yeah,
dynamic, right? So this is one of the reasons why I do what I do, because
yeah.
if people are not aware, then they don't know. I know,
Mm.
we call upon managers and supervisors to look out for their employees to make sure that they're doing well. But then one of two things is that managers and supervisors are complaining, but we don't know what to do, and we
Hmm.
don't know what resources are available. right?
This is so good. I was thinking about that. I was thinking just the need for people like yourself, in the coaching space, in the consulting space, leaders who don't invest in the development of themselves and of their people it's really a detriment.
It is.
And what they don't realize is, yes, they may have to spend for a consultant or for a coach, and it may be an initial spend, but think about the back end. Think about the back
It's an
door.
investment. Yes.
Yeah, think about the revolving door that you're losing money over here. You're losing money, you're losing motivation, you're losing morale. I mean, it's huge.
And I'll tell
Um,
you, and I'm sorry for interrupting you, Sharon.
it's okay.
I'll say this because every time I have to do a presentation in one of these settings, I amplify it. We are having a cultural and a generational shift, and I know you can
Yes,
attest to this.
yes,
Whereas back in the days, the baby boomers and the Gen Xers like myself, we learned to push through and we're gonna fight and we're gonna put our feelings on the back burner. Blah. You are having a generational and cultural shift that's occurring, and it is rapid and it is going to increase. You have
yeah,
millennials who have entered into the workspace. You have Gen Zs that have entered into the workspace, and they're telling you, listen, unless you have some protocols or some systems or policies in place to tend to my well-being and mental health as you do physical health, I'm not working for you. So organizations that are looking to attract good talent, to retain top talent, these are some things that you're going to have to start paying attention to. And so I think in response to Sarah's question, I think there's a catching up. There's a
hmm,
huge lag behind. We have some systems that are being proposed, but not too many organizations are aware of them being out there. And then I also think too, if leaders are not investing in their own well-being or taking care of themselves, then it's hard for them to even recognize when their employees are falling apart or burning out. So it has to start with the leaders themselves.
I'm glad you mentioned that because in you a couple of segments ago you mentioned about the leader burnout, and I was thinking, people bring their whole selves to work,
Yeah,
right? And as you were talking, I thought to myself, if the leaders are burnt out, imagine in their burnt out state how they're treating or
absolutely.
responding to the team, right? Because
Absolutely.
they don't. I wrote something recently about emotional intelligence, right? And a lot of leaders think they're emotionally aware, but they're not.
They're not.
They're not because they don't realize how they're coming across to the team members. And so it's all this whole development piece of, okay, what is your EQ? What is your emotional quotient, right? So that you can be more effective, because this is people bringing their whole selves to work, and
Yeah,
you need to be able to recognize it in yourself, because you're the leaders bringing your whole self to work too.
absolutely.
Leaders have lives, and they're bringing that to
Absolutely.
work as well. And being able to recognize it in yourself, and then to recognize that also in your team members, is going to be a crucial skill. Um, how do you think things like COVID, even life after COVID, have helped amplify mental health issues at the workplace?
I think COVID in some sense kind of leveled the playing field, and every level of the hierarchy got hit, right? It wasn't
Hmm.
just employees alone that were impacted by COVID. CEOs were impacted, managers were impacted. Um,
Yes,
First, super frontline supervisors were impacted. So everybody along the tier was affected in some way or shape. Or you're having lots of people along the tier reporting that I am struggling with something. So maybe back in the days, again, people weren't necessarily as vocal about these concerns. Now people are talking about it. And that's when I talk about that cultural shift that's occurring.
hmm,
That's really what it is. People are becoming more vocal. The Gen Zers and the millennials, they are more open about having these kinds of conversations compared to the older people. But let's face the facts, we're leaving, they're coming in.
that's right. That's
So the
right.
workforce is going to be comprised predominantly of millennials and Gen Zers. And then the
Yes,
alpha people are coming up after them, right? So
yes,
they're coming
yes.
in with a different kind of mindset.
Yeah, I'm seeing that a lot for sure. We just listed those five things. A lot of people are maybe concerned about AI replacing their jobs. How should employers reassure their workers and address these fears? And let me just say this: that those fears are real.
Yes,
Those fears are real. AI will replace jobs. AI is already replacing jobs, and is going to replace more jobs. So yeah, what's your thoughts on that?
How do you assure? Again, this is one of those things that leaders have to be intentional with talking with their employees about. We talk about clear and equitable leadership. That's what that refers to. They have to be willing to have these very candid conversations and speak the truth.
Yeah,
We noticed, Hollywood was on strike for a while, the screenwriters, because that was one of the biggest fears that they had. And they wanted to make sure that it was put in writing, a policy was established that yes, you probably could. We know AI is going to be a part of this thing, but we're putting barriers and boundaries around how we protect my livelihood as a screenwriter. And, how do I make sure I have that security? Talking
yeah,
about protection from harm, security, because who wants to sit and worry about tomorrow I show up at work and a machine replaces me?
yeah,
So
yeah,
leaders have to take charge in having those very candid conversations. They need to be very clear about what's going to happen. Don't withhold information from your employees. Tell them the truth. So at
mm-hmm.
least people can prepare themselves that if that's where we're heading, then that's what it's going to be. And I think on the flip side too, I share with my clients who, may be looking for new jobs. Listen, when you go into these interviews, it's no longer just asking about money.
Right.
Typically, that's all we talked about. Now you've got to be having the conversations about what role is AI going to play in the foreseeable future in this job or this position that I'm occupying, and how concerned do I need to be? What's your emphasis or what's your focus for promoting well-being and mental health in the workplace? It's not just asking about money anymore, upward mobility. You have to broaden the conversation.
That is very true. It's different, it's a different word. You think about COVID 2020 to 2022, thereabouts, right? And all of the shifts that happened because of COVID, telemedicine and, curbside pickup, all the things that are now just norm, right?
Right.
Normal life. And, they were necessities during COVID and now they're norms. Like I have these millennial kids who will not go back into a brick and mortar building because it's just not, right? And then you think about AI is coming. And if you think about, you might as well not be afraid of it because just like the post COVID or the things that we had to do to adapt in COVID, we have to adapt to AI. And I think to that question that Peter asked, I think us as employees, or entrepreneurs, whatever, whoever you are, whatever your role is, I think we better ride the wave as well and position ourselves how
Absolutely.
we can fit in to this new mix because your company won't keep you just because they won't keep 10 of you if they can do a job with 4 of you and AI.
Right.
So how can you find yourself? I think it's time for us to all re-educate ourselves, right? Become a prompt engineer. Find a role in AI that you can secure because it is gonna happen, and there's no point being, lethargic
We
about
can't
it.
stick our head in the sand like the ostrich and pretend. Yeah.
COVID
We have to
taught
be
us.
proactive.
COVID taught us.
Mhm.
As more folks are taking care of family members, usually parents, what are some solutions or conversations could you suggest for employers or folks in charge of these wellness programs? Mm,
So,
so, yeah.
okay. So, recently I've been actively engaged. I noticed that you had CareBridge on the flyer. You put at CareBridge. CareBridge is an EAP organization that I actually do some work with. But I've actually been engaging. There's a company that I work through that engages EAP programs. Those are their clients, and I will go into different organizations and talk clearly about what their EAP program offers. Right.
Hmm.
One of the things I know about EAP program is that it is morbidly underutilized. And these EAP programs, they're not all created equally, but a lot of them do provide support in some of these areas, such as childcare and elder care. If you're looking for resources, they're able to connect you with some of these resources that you don't have to do these things on your own. And the whole idea is that it eliminates one less stressor that you have
Hmm.
to encounter in addition to work or in addition to your personal life. So, people who are caregivers, there are resources out there. I would encourage you to go speak with your HR person. I know sometimes we only hear about the EAP benefits when we're onboarding or, yeah, during the
Yeah.
onboarding or orientation process. And then
Yeah.
afterwards, you hear nothing else. And that is probably something that employers or organizations need to do a better job of notifying or informing their constituents constantly, constantly letting them know that these resources are available. But EAP programs will help you with mental health. You could get
Mhm.
some free mental health services through it. I've had many clients come to me through their EAP programs, financial legal services. They have resources that could point you in directions if you're needing elder care, even something as simple as if you can't leave work to go pick up your mom, your elderly mom, to take her to the doctor's office for an appointment. They could connect you with a resource in the community that could transport her or help you locate an elder daycare or help you locate a child care. Those kinds of resources are available. It's just a matter of leveraging them or making sure that you're informed about those services. One of the other things that I think also is important is the need for community.
Mm.
There are lots of groups that are out there, whether it's online or meeting face to face, that provide support to caregivers, right? We're not meant to do life alone. And so connecting with other individuals who are caregivers themselves, it makes a world of a difference when you know that you're not functioning in these spaces by yourself.
Awesome. Now, Georgia, as we get to the end of today's program, right, I want you to speak to two audiences. One audience is to the leader of a small firm, small company, maybe 12 and under employees, right? What would you say to that leader who's like, they want to do better, but resources are tight? Give them one thing that they could do to begin to shift that culture towards more wellness friendly. So that's one audience, and then to the other audience is to the employee who feels like, man, I'm burning out, and I feel like I need to leave. Before they leave, is there any advice you could give to them before they leave that they could implement to somehow, I don't know, give the boss a chance or to survive in their environment? Because sometimes people job hop, but then the next job is just as bad, right?
Gotcha.
So two audiences, and I'll let you give that last word.
Sure. So for the employer who employs, say, 12 or under, listen to your people.
Mm.
I don't know if it could get more fundamental or basic than that. Listen to your people, right? So I'd mentioned earlier on about this idea of psychosocial hazards in the work environment. These have to do with those factors that could contribute adversely to the well-being of your workers. And every work environment has them. It just comes with the territory. It's the way how you organize work. It's the social factors in the work environment. It's the nature of the work itself. So one of those factors has to do with leadership. It also has to do with culture. What kind of culture are you cultivating? Do you have an environment in which you listen to your workers? If they're telling you certain things that's happening in the environment that's impacting them and causing them to experience stress or burnout, or you are observing that they're functioning differently, it's worthwhile sitting down and having a conversation to say what exactly in how we're doing work that could be contributing to you experiencing burnout or the level of stress that you're experiencing, and what can we do differently. Listen, nobody knows what employees go through more than the employee, him or herself. They are the
Mhm.
best source for insight, and they're also the best source for coming up with solutions. So don't just give people what you think they need. One of the EAP stuff that I would encounter when I worked is that they would give you money towards joining a gym. A lot of people didn't go to the gym because they didn't have time to go to the gym because they were overwhelmed with work. So just
Right.
find out from your workers what's going on. What are some things that we need to address? Do you think the workload can be altered some way? Is the scheduling good for you? Is it working out? How is the relationship between you as an employee, me as a supervisor or the leader or the boss? Are there areas where you think I need to make some adjustments because it's affecting you? Do you feel psychologically safe in this work environment? Have conversations, ask questions, listen to your staff. The
Before
flip
you go to the
side,
next one, Georgia, what you said is so key. And I just want to just add this little piece. Whether you are an employer with 12 or 50 or whatever, as a leader, it's so important that you first train those managers, because you've heard this saying before over and over: people don't leave bad jobs, they leave bad managers. And what you're saying requires the manager level, the people who are directly supervising the employees, to have a sensitivity towards this mental health and be mental health trained. Because life shifted. We didn't care about mental health as much prior to COVID. It was there, but it wasn't a factor in the workplace. We weren't hearing about quiet quitting and the one before the Great Resignation.
Great
We weren't
resignation.
hearing about those things, but we're hearing about them since COVID. So I still see the lack of training at the manager level. And leaders can get, they'll do the executive coaching and it's wonderful, but there still needs to be an investment in the manager level where your managers are trained and
Absolutely.
updated on the mental health issues and challenges and how to address them, just culturally. It goes back to what you said again, George, about, the culture, what's the environment like? And,
Yeah.
culture is, I use the word culture a lot because culture is huge. All right.
Right.
So that is for the employers, employee.
And I also think too, you have to make mental health and well-being integral to your work. That has to be a part of your mission. From a leadership standpoint, it needs to run through the fabric of your organization, so your managers are aware of that. This is important to
Exactly.
us from a mission standpoint, a vision standpoint, and these are the things that we advocate. So when it comes on to managers, they already know C-suite is about this life. We need to also be about this life in relation to our employees. From
Totally
a,
agree.
from an employee standpoint, you are responsible for yourself.
Yep.
Let's not kid ourselves. You come into work with a primary responsibility, and that's to get the job done. You're being paid, you're being compensated for your skill sets to be leveraged. And so there's some things that you have to do for you too. So if you are overwhelmed with work, for example, perhaps you need to look at your time management, or your organizational dynamic. How effective are you at that? And if you could sit with your supervisor or manager and have a conversation about, maybe, do I need to change the way how I'm approaching managing stuff? Because some of us, we're not trained with that. We come into
Hmm.
the job and we're falling apart because we're all over the place. Coaching and mentoring, that's some of the things, leaders can do in the work environment to help their workers kind of get some things intact or straightened out, so they're not as overwhelmed and easily burned out. But you, as an employee, that's your responsibility to open up your mouth and ask for the support that you need. You have to ask. And then building your own level of resilience. That
Hmm.
doesn't necessarily happen on the job, but it's going to be necessary for the job. So, what are some things you're doing outside on your own, in terms of your own personal development, in terms of your own professional development? These are things that you have the ability to work on that will help you fare well in the workspace. Self care, taking care of you. How much are you vested in that? Yes, we're expecting the employers to put some systems and protocols in place to make sure that your mental health is being taken care of or being protected. But there's some things that you have to be doing on your own as well, outside as well as inside the workspace.
Well said. I'm a big proponent of, personal responsibility. And
Absolutely.
I'm glad that you said that. And I wanted to bring up that point because, a lot of employees, they job hop, right? Everywhere they go, there they go, right? Everywhere they go, there they go. So you need to stop and assess. You have that emotional intelligence too. Like, what am I doing wrong? So I'm glad you really got into that, dig into that. Georgia, thank you so much for being here today and for dropping the knowledge, the diamonds and the gold
Thank
on
you.
our folks. And for those of you who are watching in a replay, you can go ahead and feel free to connect with Georgia and reach out to her. Georgia, tell us how, who is your ideal client on the corporate side?
Okay. So definitely looking for those organizations that are ready. This is something that's important to them. They
Hmm.
value their golden geese, if you want to put it that way, because your employees are what makes your business run. If the employees are not functioning, your business does not function. So those
Yes.
employers who recognize the need and the importance for putting systems in place to make sure that you're designing work where your employees' mental health and well-being is being taken care of or being protected. You're ready to get that done, but perhaps you don't know how to do it. This is why you have me here. You don't have to do it in a silo. You don't need to sit and figure it out with Chat GPT. You have individuals in your community who are able to come in and collaborate in that regard.
So you all hear that? You know how to find Georgia. She's linked in this comment. So follow her on social media. She's open for business. All right, Georgia, thank you so much.
Thank
Just
you for
stay for
having
a
me.
second while I wind this up. And thank you guys for watching. And I'll see you guys on the next Tea Talk. Take care.